Welcome, everyone. Please have a seat. Thank you very much. Thank you very much, everyone, for coming. I'm really thrilled to see you all in person and also to see you digitally joining us. My name is Irene Fialka. I'm Managing Director of Health Hub Vienna, and I'm honored to ask on stage with me the host, so to speak, of this event, Erich Kruschitz, in the name of UNICA and SanusX, and Alexander Biach, in the name of City of Vienna, who is supporting us as Health Hub Vienna as one of the lighthouse projects here in Vienna in the strategy City of Vienna Health Metropolis 2013. Erich, thanks for having us here, for giving us the opportunity to be here. A couple of words in the name of UNICA and SanusX, please.
Thank you, Irene. Thank you for hosting this again here at our UNICA Tower. I can talk here on behalf of course, UNICA Stiftung, but as well as UNICA as an insurance company, and also SanusX, the health carrier of UNICA, where we are developing new healthcare services. We are really proud of being a partner from the very beginning, since 2017 of Health Hub Vienna. I just talked to the team today, just to give you a little bit of an idea, the last 5 years, what did we do together, and I think it's really a success story, and that's why we're also always super open to open our doors as well. Just from our side, we can really say that we really saw the positive impact on the ecosystem and healthcare of the Health Hub Vienna here in Vienna, as well as in Austria, as well as in our region. Just to give you some example, the SanusX, for example, we recently invested in Wallaby, a super successful prevention company recently, actually at the beginning of this year in the first quarter, but still it's a Health Hub Vienna company. We've never would have known them, and we absolutely successfully work with them together. There are so many things that come to my mind. You work together with Stellvertretender, one of the first DIGA-compliant companies in Germany, which is also a strong partner of us. We can talk about Symptoma, which is a really internationally successful symptom checker, now sitting with us together in one office where we also have some share of this. We worked together on a white paper on digital health, which was extremely important. I cannot tell you how important it is for us that we finally have the EIT Health here in Vienna. I think that's also really important for the ecosystem here to put Vienna on the map for healthcare. Again, EIT, an important partner for us. Super interesting for us. We did a startup competition with you together, Elderific, on the active aging last year. So many things that came from the team, so it's really a success story. So we are proud to be a supporter. We are dedicated and keen to further work with Irene and the team. Thank you, Irene, for this successful collaboration, and wish you a great afternoon here at UNICA Tower, and happy to host this today.
Thank you very much, Erich. Alexander, what does it mean, Health Metropolis, City of Vienna, and why Health Hub Vienna, and what else?
Well, it sounds good, it sounds great, but thank you for the invitation. About 3 years ago, the City of Vienna started some kind of strategy process. They identified about 6 fields of strength, like the Vienna being famous for culture, being an international meeting point, tourism, also the smart city, for example. But they also identified as one field of strength the health sector, the healthcare sector. So we said it is not only something we are very famous for, like the old Viennese medical school and the tradition about it, but it is also a field of growing economy and developing economy in the field of healthcare. And I was quite proud of being responsible for identifying some lighthouse projects, as you said, which somehow pay into the account of this health metropolis. And the aim is to identify about in several fields healthcare projects which will form and make Vienna to a modern health metropolis. So what we did is we focused on 3 fields. The first one was identifying healthcare infrastructures projects, like for example, the Precision Medicine Center which will be located in the year 2026 on the AKH, on the General Hospital campus. A great thing, because it will not only bring about 600 international researchers to Vienna, but it will be also somehow hosting startups which can communicate with these researchers. We identified, as you mentioned before, the field of international organizations. We are proud of having the EIT Health now in Vienna, but we are also working on getting a notified body in order to get certificates for all the medicine products. This will also be some kind of magnet function to get new startups to Vienna. And for certain, it is the digitalization sector. It's one of the most leveraging field in the healthcare sector, using data wisely and transferring them into projects for healthcare is one of the main tasks. And this is why the Health Hub Vienna is also one of these lighthouse projects. Because what you are doing, Irene, is you try to translate the Viennese bureaucracy system and the politics system to the young startups and otherwise, and what you form are wonderful companies which make this health metropolis worldwide famous, and therefore thank you, and I'm eager to hear about it.
Thank you very much, Alexander. Thank you very much. Last but not least, I would like to briefly introduce Health Hub Vienna. Health Hub Vienna is really a collaborative effort of all companies, organizations, be it academic organizations, be it businesses, be it public organizations, to really drive change and digitalization in the healthcare system, with the focus of Austria, but also to establish Vienna as one central place of drivers, as a driving force for innovation in healthcare. Yeah. We work together with companies like SanusX and Unica, but also AstraZeneca, Novartis, you will see DHL also. You will see some examples, besides some examples that Austria has to show in general. You will some examples of projects that we've started, that we've initiated, that are running already. So our message is really the future of health is not the future, but is really happening today. And this is what we want to show to you today. And I'm really looking forward to a couple of presentations. I would like to also hint at the digital booths. You can, for the digital audience, we have some digital rooms where you can experience and see different solutions, digital solutions that are available already, that you can use in hospitals as patients, etc. Please take the time also after the program to enter into those booths. In many cases you will see a video, but you will also have the opportunity to get in touch with the people, the responsible people behind those solutions, and get in touch with them, exchange experience, chat with each other, use the digital room also. That will be open until midnight, so you can enjoy the time also in the digital space as we go. Thank you very much, Erich. Thank you very much, Alexander. Thank you, please. Thank you. I would like to ask on stage Ursula Weismann. She is CEO of SVC, which is really the organization handling e-health solutions in Austria. Just to name a few, the e-prescription solution, e-card, they are running the e-card, and she will tell us a little bit more about everything, what is going on in Austria.
Yes.
Thank you very much, Ursula.
Thank you very much. Have a very nice afternoon. I will start immediately with telling you the story of Mark. Mark, 45 years, he wakes up in the morning with dizziness, pain, chest, terrible. The only sensitive way to deal with this situation is to call 1450. You know 1450? If not, check your e-card. The number is written here. So he calls 1450. This is our nationwide telephone health advisory board service. So it was a big step. It was introduced in 2019, as I remember, and it was a big support in dealing with the corona pandemic. So now what is there to come? What more is there to come? They will work on an app so that patients can provide personal data or medical data so that the service of helping them what to do in this situation will be easier. And there will be a possibility so that you can start your call with this app and you can even ask for a call back. Okay, what do they? They advised Mark to immediately go to the hospital. They called the ambulance, actually, and so he was within a couple of minutes, he was in the hospital. The hospital, of course, they have already access to medical data. We call it in Austria ELGA, it's the electronic health record. So what do they have there? They have a discharge summary, they have lab reports, they have radiology reports. It's there. But I have to be honest, if you look on the slides, there are all, at the moment, no records from doctors. But we will do this. I mean, it's not a technical issue. We have to speak with them about this topic, but it will come. Next year, there will be diabetes records, and to support telemonitoring, we will have, for example, episode reports. But the hospital also has access to e-medication. I'm not a doctor, but I was told if you see the medication list of a person, you have a very good insight on the overall condition of the person. So e-medication, it works. It was introduced to Austria in 2019. Medicating doctors and pharmacists have access to this list, and pharmacists can add interactive OTCs if the person wants this. So after 2 weeks, Mark is discharged from the hospital again. At home, he can log into the eHealth portal. You can see here the cockpit view for a person, and Mark can check the discharge summary already. He can also see his e-medication lists. He can see which doctors had access to his data. Well, he immediately organizes an appointment with his doctor. His doctor, for example, he also has access to the electronic health record, to e-medication. In the discharge summary, the doctor finds recommendations of the hospital which drugs could possibly Mark support. So, easy for the doctor to use e-prescription, in Austria called e-Rezept, so that Mark will receive these drugs. I'm sure all of you have already used e-Rezept or e-prescription. How does it work? Easily. A doctor can prescribe medications, and then you can walk to the pharmacy and you can hand in your e-prescription either with an app or with the paper prescription or with codes. But Mark, he's tired. He goes home without taking the drugs from the pharmacy. But at home, he can log into meine SV, my social security, and he downloads the prescription, sends the prescription via, for example, WhatsApp to his wife, and his wife will go to the pharmacy, she will present the prescription, and she will receive the drugs. The big step was taken this year because e-Rezept or e-prescription was introduced to Austria this year. There is more to come. Next year, we will also operate private prescriptions like birth control pills. They are not covered by the health insurance, you have to pay on your own, but it will be possible to have it in e-Rezept or e-prescription. Narcotic drug prescriptions. I mean, it's not an issue for us, I'm sure, but in case you have this, you will have a vignette so that you can receive those drugs in the pharmacy. We will include this in e-Rezept as well. And last but not least, cross-border exchange. there will be a possibility so that you will have a prescription in Austria and dispensation in any other European country. So the doctor reminds Mark that it would be a very good idea to have a flu shot. Okay, it's done, and then it's stored in e-vaccination. This year, no, last year already, e-vaccination pass was introduced to Austria. So almost everyone, every person with a social security number has got this e-vaccination pass. There's a lot more to come. Next year, I hope so, pharmacists can add from paper passes the vaccinations to e-vaccination. And then I hope I can get rid of all those yellow pages. What else? There will be a possibility that citizens can add vaccinations from the paper to e-vaccination, but of course there we need some kind of validation. Midwives, they administer vaccinations and they will have access as well, and they will add those vaccinations to the e-vaccination pass. And last but not least, a very important point, there is a plan of vaccinations in Austria. And this will be linked via an app so that we will have personal recommendations and personal reminders what vaccinations are there for everyone. I was told that the government benchmark 2022 mentioned e-vaccination as an international good practice. So now, Mark is back at home. He could now have teleconsultation with his doctor. There is a very good product. It's Visite. It is it's in a pilot status, but with Visite, Mark could have teleconsultation with his doctor. There will be some more steps to come. For example, it will be possible to gain access to the electronic health records with the near-field communication possibility of the e-card. So last but not least, I've told you that you can have e-prescription and you can, for example, download your prescriptions. You can do this via meine Sozialversicherung, meine SV, my Social Security. So last but not least, what will be there next? One of the biggest projects that will be in the following years will be the mother-child pass, quite similar to e-vaccination or e-medication. It will be a very huge project because midwives will be in this project as well. So, finally, some numbers. We have more than 9 million persons in Austria. They are in the master patient index. They have got an e-card, so they can use the electronic health record. We have more than 9.3 million e-cards in Austria. We have only approximately 300,000 generic opt-outs. We have at least 125,000 visitors in the electronic health record portal or ELGA portal. We have some 400,000 visitors with meine SV. Current usage, we have approximately 1.2 million new e-reports monthly by the hospitals. We have, you can read it by yourself, but we have, what is very important, 10 million prescriptions in e-medication every month. And we have so far 22 million vaccines in e-vaccination. Thank you for your attention. I was with him at 10 minutes.
Perfect. Perfect timing. Thank you very much, Ursula. I am sure there are some questions. Now we know everything that we can do already. Are there any questions? Please.
Thank you. Really nice presentation. Stefanie Wachner from Pfizer Austria. So I actually find especially the e-vaccination really nice because we all know these yellow paper thingies and they just always get lost for patients. So I'm just wondering, because you mentioned that for the Austrian vaccination recommendation, this will be linked to the e-vaccination.
Yes. There's a plan to do this.
Yeah. So for the vaccination recommendation, the patients, there are different groups for at-risk patients or high-risk patients. And is there, do you also think about including this, like automatically assigning, the patient to one group?
To be honest, I don't know.
Okay.
If there are thoughts about this. I can check what I find out, but I can't answer this.
Okay, thank you.
Martina.
Now you do. I was wondering, it's actually very similar to the question before. I was wondering if you have an automatic reminder for the vaccination, if you plan to do the same for early detection or prevention, because, other countries do already. So they would remind people,
That's the plan, to remind with a link to the Austrian nationwide plan.
Yes, super.
Yes, of course. But we will need some kind of digital ID. So it's about having a mobile phone or a digital ID. So if you can't have this, then you can't log in either in the portal of the electronic health record nor in MeinSV. And you need this, otherwise no one can inform you about, for example, a reminder for vaccinations.
But didn't we all get that, so to speak? Many of us, at least, have,
2 million
been vaccinated. So there is a huge number of people who have an ID already.
No, 2 million. 2 million. It's not even a quarter of the Austrians. And I would say, who is using this like once a month? Not a lot. So 2 million have one, seldomly used. So we have to encourage people to have a digital ID.
Yeah, but if we can create that value, probably it's also a driving force to lure them into into the system, so to speak.
Yes.
My name is Begoña San Jose. I have a question regarding chronic conditions, because...
For the digital audience, please.
Yes, I'm sorry. My name is Begoña San Jose. Hello again. I start. My question is regarding chronic conditions, because the case you explained for Mark is simple. In acute care, it works perfectly well. When somebody has a chronic condition and it needs refills all the time, can we automatize that somehow so that the refill is for the period that the drug has been prescribed, for example? So hormone replacement therapy, for example, can be for 6 months and you have to go every month and ask for a refill.
Yeah.
It
you don't have to go.
Much better,
yeah, you can call. Yeah, so this is new. You can call your doctor and you can ask for another prescription. You don't have to go there anymore.
Yeah, but you could do it also more automatically than that.
Yes, but I think this won't work with our doctors.
Anne?
And Marilenen, my question is around intelligence. So what kind of intelligence do you want to generate with the big data that is available? So recognizing trends in pandemic infections, for example, or recognizing demographics also, birth rates and etc. What kind of insights do you intend to generate?
You know, I'm from the Social Security. Yeah, so we use artificial intelligence, but in a completely different way. For example, if you have been to a private doctor and you want to get reimbursement, then we use artificial intelligence, for example, to make this process more easier so that you will have your refund. But the Social Security does not work from a health point with data. So I'm sure one of the other colleagues here will answer your question later on.
Thank you very much. I saw the question, but we need to move on, I'm afraid. please keep the question in mind. You will have the possibility to ask any kind of question later on again, because Ursula will join us again on the panel. Thank you very much, Ursula.
Thank you.
I would like to call on stage now Katja Österreicher. She is Innovation Manager at Vinzenz Gruppe, a big private hospital group. And also Jakub, who is her partner in crime, so to speak, at an innovation project. She will introduce. Jakub is CEO and co-founder of Datlowe, and together you claim you can support hospitals to really fight hospital and healthcare associated infections. Please, the stage is yours, Katja.
Thank you very much. So thank you for inviting us to present our joint case of a pilot implementation of our technology HAIDI in Vinzenz Gruppe. And it's really great to be here again, because this whole collaboration actually originated here during the Health of Vienna program, not really here at Unikatawa, but really during the program later on. So I'm a co-founder of a health tech company, Datlowe. We're from Czech Republic, from Prague, and we're helping hospitals to mine the data that they have in their information system and to transform them into usable insights, basically. And we're doing it by delivering specialized clinical apps that helps them to improve the quality and efficiency of care. And the first app that we have on market now is HAIDI. And this is like the case that we're presenting here. And let me introduce a bit of HAIDI. So HAIDI is a tool for infection prevention teams in hospitals, and it helps them to fight hospital-acquired infections. I don't know if you know what a hospital-acquired or healthcare-acquired infection, healthcare-associated infection is, but it's actually an infection that you get while staying in the hospital. So you come to a surgery and you get an extra infection while there. It's nothing that you want to get, but actually this affects about 4 million patients in the EU every year and results in about 20 billion euros of extra cost for healthcare systems. So it's quite a big problem. It's kind of a hidden problem. Nobody wants to talk about this, but it affects the quality of care very much. And the problem is that the hospitals are tackling it in a different way, and sometimes they struggle to collect accurate data about infections, of healthcare-associated infections, so that they can target the preventive measures effectively. And this is something that we help hospitals to overcome. We help them to gather the data and to be able to monitor these infections and fight them effectively. And we're using our tool HAIDI, which is an AI-based software solution for automated surveillance of HAIs, which automatically detects potential healthcare-associated infections based on the documentation in the information systems, and helps hospitals as well to uncover the root causes why these infections are occurring in their facilities. So how does it work, basically? It reads all available electronic health records. So if you imagine like a bit more than is stored in ELGA, so every record that's typed into the system from the admission notes, daily progress notes, etc. It uses advanced technologies such as natural language processing, extracts information, symptoms, diagnoses, lab results, etc., and detects, based on all of these informations, potential healthcare-associated infections that then delivers to the infection prevention teams. This is something that helps infection prevention teams to be much more efficient than they were before. So it helps them to save time that they spend on reviewing patient charts and the administrative tasks a lot, and increases the quality of data because it does a hospital-wide surveillance of all types of infections, so it checks all the data. It does not get tired after reading 10 patients. And it helps them then to focus on the prevention and use the data to interpret it and to target the preventive measures where it is needed the most. So when you know there is like an increase of infections at the internal medicine department, you go there, you do the audit, re-engineer the processes, and improve the quality. And this is something that we have been able to work with 25 hospitals now in Czech Republic, Austria, or Slovakia and Austria. So it's quite a big portfolio of hospitals right now. And here in Austria, we are very happy to have been collaborating with Vinzenz Gruppe, especially the Krankenhaus, Barmherzige Schwestern Krankenhaus in Ried. And I will hand over here to Katja to give a bit overview of what Vinzenz Gruppe is.
Thank you so much. I think nothing more to say. Jakub put it all together in a brilliant way. Yes, our Krankenhaus in Ried is our pilot hospital who is doing with us together this pilot for almost 1 year now. It's a very nice project and I'm very, very happy that it started here at Health Hub Vienna in 2019 already. And I am part of the mentoring program from the very, very first beginning. So thank you very much, Irene. We detected out of this cooperation already 2 success stories. The first success story is Dr. Health AG, Ulrich Müllner. I have seen him here as well. He will be probably on stage as well. So very great program. Thank you so much for this very successful and great cooperation. Yes, Peter Drucker, an Austrian one everybody knows, he's told us already the greatest danger in times of turbulence is not the turbulence, it's to act with yesterday's logic. And so this is one of the visions of Vinzenz Gruppe. I'm very happy that I can, or I am responsible for the Department of Innovation Management at Vinzenz Gruppe since the end of 2019. We have developed our own innovation strategy until 2025, and so we have a clear roadmap where to go. A short overview of Vinzenz Gruppe, if somebody doesn't know us till now. We are one of the largest employees companies in Austria. We have about 10,000 employees at the moment. We have 5 hospitals in Vienna, 2 hospitals with 4 different locations in Upper Austria, and we are a platform of religious order hospitals, care homes, and rehabilitation facilities and prevention services. We operate on a principle of public benefit. This is very important for us, but we are still a public hospital group. Yes, here you can see an overview of our partnerships and our locations, mostly in Vienna, Upper Austria, and in Lower Austria, where we have the Pflege and Wohnen, so the care facilities for people in Vienna and Lower Austria. We focus on human experience, so this is a vision for Vinzenz Group for a very, very long time, focusing on the needs of the patients, customers, and of course our employees is the key factor for success. It's the key factor, in our opinion, for successful digital apps and platforms and solutions, and we are focusing as well in cooperation with startups, with young companies like Datlowe, and we are very, very happy because they support us with an entrepreneurial mindset. They are very flexible, really agile. If we have ideas, they just do it for us. Yeah, so it's very uncomplicated working together with them. We are very lucky, or I am very lucky, that we have employees who are really open-minded and ready to work together with startups. This is not for sure, I would say, in my experience. So it's a win-win situation. I've got a note because I have to read it, otherwise I don't got it right. At the end of the day, many birds are killed with one digital fly flap. I should tell you from our hygienic team of Ried. This is quite funny, I guess, so I put it with me, so I got it in the right way. Yes, this is a part of my team. We work together in our innovation center in the 3rd district of Vienna. You are more than welcome to visit us and use the rooms, of course, as well. And yes, as we told us before already in 2019, we met here together. And why we decided to go with Datlowe and his team was very easy. It was the mindset, it was the team. You have a very smart team, and of course the solution. And the secret is the surface of this software is really user-friendly. It's easy to learn. It's now implemented in our routine daily work. It took the team, the hygienic team, about 20 up to 50 minutes to work with this. And the advantage is on the hand. We have a current number of nosocomial infections daily in our routine work in our hospital. So thank you very much. We have plans for the future we will discuss tomorrow. So the vision is, of course, that we can implement that law in all of our hospitals in Austria. Thank you very much.
I would add one more thing, one more slide. Like I don't want to forget about Dr. Halabi, who is like the leader of hospital hygiene in the Barmherzige Krankenhaus im Ried, and he's really enthusiastic about new technologies, and he's like a really great doctor. It seems to me like he's managing everything, like doing like a lot of stuff and being everywhere. So he's really busy, but without his enthusiasm and his team, it wouldn't be also possible. That's always you need to have great people for innovation that puts the umbrella in and some processes, but you also have to get the internal champions that really takes the solution as something that really helps them with their daily work, and then we can deliver the results effectively.
Thank you very much.
Thank you.
Thank you very much. May I join you here?
Sure.
Maybe I'll go in the middle. I am sure there are questions. If not so, I would like to ask a question. Do you have already some kind of solid statistics, how much you saved, how much time was saved, whatever? Or do you already see a reduction? Because that's something that's the goal, that's the value of the solution. So what is your experience after 1 year of using it?
It's not yet a year, so we are still in the pilot, and we will measure it. We have no numbers I can present it now, but yes, we detect already more efficiency. It's really much easier for the team in the daily routine. Yeah.
Okay, and what do you think was really the deal breaker, so to speak, to convince the doctors? Because obviously you have, as we heard before, it's not so easy to convince doctors to use digital solutions.
I'm wondering your answer. Yes.
I think I don't know if there's a simple answer, like silver bullet you can use everywhere. I think in general, people are open to use tools that really help them. They're not willing to use digital tools just for using digital tools, but if they see clear benefit, because they hate paperwork, they hate reading all the stuff and filling out all of the spreadsheets, etc. If something helps them to save time on this and focus on the patients and working with people, it's really different. And then you have to present it in a way that they can understand it, they can see the clear benefits, and you have to be humble enough and show some respect and knowledge of the whole environment. That's something like what we are trying to achieve, basically. When we're, it's in general, it doesn't apply only for Ried, or it's the same everywhere, I would say.
I would agree, and we changed excellent a lot of paper to HAIDI. So this is a real change and an advantage. Yeah, definitely.
Questions? Yes.
Thank you. Anniko Fejes, Novartis. My question is rather about the timelines. For how long did it take for you to set up and make the pilot working? And something what is rather also directing towards the future. I saw that there is one pilot hospital currently in Austria. If the results support, of course, are you planning to do a scale-up?
Yes, we're planning to do that as well. That's how long it took. Usually it takes, in a hospital, it takes like 3 months to implement. In Ried, it was like 5 months, I think, because it was a different internal system that we have to use and done. So the biggest part is spent on integration with the information systems. That's usually like hardest part to get over, basically, I'd say, if you agree.
Yeah, I agree. We see actually a very high potential in this connection from HAIDI to our digital fever curve, which we have implemented in all our hospitals now, and as well to the clinical medical information system, because most of the data of the patient data are of course stored daily in the digital fever curve. So this is one of the next needs, this connection, HAIDI and digital fever curve.
Thank you.
You're welcome.
One last question we have. And please, a very quick answer. Otherwise,
just some curiosity. Does it help also to do the root cause analysis and help in prevention?
Yes, it also, evaluates like what happened before the infection was acquired, but it's always like for now it's like a backward analysis. So it looks what happened and if there are any like steps in the treatment that increases the probability of acquiring an infection, basically. So for example, for surgical site infections, you can look like what type of surgery it was, how long it took, where it was done, etc., and see if there is anything that that's not really in the mean.
Thank you.
You're welcome.
All right. Thank you very much.
Thank you.
Thank you.
Thank you
Jakub.
for inviting us.
Thanks for being with us. Now we switch. Please have
Thank
a
you.
seat again. Now we switch pace, so to speak. What you will see now is really a 5-minute staccato of projects of partners of Health Hub Vienna. And we will start with AstraZeneca. Gerhard Ladengruber, he is head of corporate affairs at AstraZeneca, and he will present together with Ulrich Müllner, the startup CEO and co-founder of DocDoc Health, also a booth that you can look at in the digital space. And they will present how digital tools can really be used to create value at the patients and in research. Please come on stage. The stage is yours. Gerhard, thank you, and Ulrich.
Hello, it's a great pleasure to be here. Gerhard Ladengruber, Head of Corporate Affairs of AstraZeneca in Austria. As you probably know, AstraZeneca is one of Europe's leading pharmaceutical companies, very much focused on research and development of innovative medicines. But today we are here to talk about digitalization. Since 2020, we are a proud co-partner of the Health Hub Vienna, and we do invest a lot in digitalization because we truly believe that health digital solutions will play a crucial role in healthcare systems now and even more in the future. Digital health solutions can support the treatment. It can support to deliver the benefit of innovative medicines to patients. It can help to raise awareness of diseases for patients and healthcare providers. It can help to identify the right patients for precision medicine, and so ultimately increase efficacy and efficiency of the healthcare system, improve life of patients, and make work life of healthcare professionals more easy. And this is why boosting digital health innovations is really a key priority for us as AstraZeneca, also in Austria. And we are very proud to present today, also after, let's say, 2 years of really engaging in the digital health ecosystem, our first digital health solution that we were able to implement together with the Medical University in Vienna and Ulrich Müllner and his team from DocDoc Health. We have started this week an observational real-world evidence study at the Medical University of Vienna, fully digitalized thanks to the DocDoc platform from DocDoc Health. And very few sentences. We wanted to make the study as convenient as possible for patients and for healthcare professionals. And with the digital DocDoc Health platform, we can now fully digitalize the whole process, so patients will receive as tailored questionnaires sent by their physicians, by the study physicians, and the patients can answer the questionnaire via app on a mobile phone, wherever and whenever they are, whenever they want, while they are at home, sitting on the couch, and they no longer have to go every time to the study center. And at the same time, we also support the studying physician because they can see important study results, also the progression of the study, by one click, real time, at any time they want. So now I can hand over to Ulrich, who may introduce DocDoc Health and maybe one sentence about the project.
Thank you, Gerhard, and yeah, thanks to the Health Hub Vienna team and AstraZeneca for this fantastic collaboration. Also, thanks to Katja for mentioning the other project, which is of course not focused today, but was also a fantastic collaboration. Yeah, maybe one word about our company, about our platform, and then about the project that we jointly embark on. So DocDoc Health is a Swiss-Israeli company. We were member of the Health Hub Vienna Batch 3, I guess. Through that, we got exposed to many interesting companies, and two of those resulted in a partnership. What we have built, actually, as Gerhard nicely already introduced, is a very comprehensive digital platform which connects healthcare professionals and patients. And with that, we can really support multiple use cases, and can also support multiple stakeholders in the healthcare ecosystem. Some of those you see on the slides. Actually, only one slide I bring, so I just focus on this one. So we support pharma companies, as Gerhard said, in real-world evidence studies, in observational studies. To talk about this project a little bit, the goal is, as Gerhard said, to collect much more data about innovative medication than has been collected already. As you know, at least if you're in the pharma space, real-world data become more and more important these days. And this is difficult to capture. It's very expensive to capture, and this is what our platform does. But we not only support pharma companies, we also support, for example, hospitals in virtual care approaches, call it Patient Portal in Germany, and we also support payers. So also eager to talk to the colleagues of SanusX later on about hybrid care approaches, in particular in the chronic care space. Maybe with that, back to Gerhard, final words.
Yeah, I mean, for us, it was a great journey, and thank you very much for the Health Hub Vienna to support us also in setting up this project. Of course, our aim is to have one project each year, and I'm really proud that this was the first project after a lot of work done by our medical team to set it up in Austria, and it will deliver very important real-world evidence data that can be used for further development. Thank you.
Thank you very much. Thanks for being with us. If you have questions, you can ask them later on the panel. Gerhard will also join us on the panel again. Thank you very much.
Thank you.
Yeah. Next, I would like to ask Labib Katzkatz onto the stage. He is Business Development Manager at DHL Express Austria. And DHL, you might not associate with healthcare, but they are doing a lot there. And I'm looking forward to hearing from you what transformation in healthcare means for a logistics company. Thank you very much.
Great, thank you so much, Irene. Ladies and gentlemen, also to all digital participants, hello. Connecting people, improving lives. Yes, that's our motto when DHL Express looks into life science and healthcare as an industry. We have a lot of people of you know us. We might have some products that we shipped already for you, but what do we do in the life science and healthcare industry? We, as an example, have shipped over 2 billion vaccine doses. So we were there when emergency needed it. And we have a global network that expands into 220 countries and territories worldwide. So we are quite global. And we have 3 innovation centers that also give us some special knowledge that is always very fruitful, not only for us, but also for customers and partners that we work with. So yes, healthcare generally is in technology-driven transformation. It goes very fast. And we have a lot of customers that already ship with us wearables and gadgets that are already bringing this technology aspect into life science and healthcare. What does it do? Yeah, with such features, of course, the providers of wearables and other IoT devices, they promise their customers to have continuous monitoring and be also faster when it comes to certain changes in their health situation. And this is why, of course, this patient then also requires some timely initiative to be done for him to be felt also as a kind of appreciated experience as a customer. So yes, everybody who's collecting such data needs also look to work on big data. Big data is very not just good thing, but it could be a hurdle if you do not manage to analyze all this data effectively. So artificial intelligence is also there to help So a lot of studies show that artificial intelligence can reduce such an analysis of diagnosis and to help us to also be faster when it comes to reacting for this patient demand that is out there. So a faster diagnosis is something that the patient wants in future, and this is very essential, of course, because this gives healthcare the first time to be very proactive, to be very close to the patient and answer to his demands very quickly. So yes, DHL looks into a lot of supply chain solutions that are resilient for our customers, and we, of course, try to always adapt to very intelligent, forward-thinking logistical scenarios. This is very, very important right now because we're talking here on directly to patient deliveries. This is very essential because the patient today is changing. You have seen it already in a lot of other industries like e-commerce, where a customer suddenly in retail had the opportunity through internet to do one click, and it triggers a lot of things in the background. And all those things matter because this patient is keen on getting priority services and be heard and seen. So for that, logistics is a game changer because we can enable a lot of startups that we work with to be very fast and bringing those products to the customers, which is very essential also when we look into clinical studies and whatsoever. Also, it's very important to highlight that on-demand delivery, which also, again, if I take on the glasses of an e-commerce industry, this e-commerce customer would like to have today, I just order something, and somewhere here in Vienna, I want to receive my product tomorrow. So also the patient would like to have that in future. If I click on something, I want to have it tomorrow. I cannot wait. Maybe I have an important flight to take whatsoever. So direct to patient is very important, and we work closely with startups to look into cost-effective methods, how to make this direct-to-patient transfer possible. Yeah, and here again, I would like to mention that the healthcare demand, this change in the supply chain, that is essentially taking place somewhere in the backline. This is taking place, and that has to be, of course, cost-effective. Logistics might not be the priority of healthcare, but it is a cost point that needs to be taken into consideration and enables you to be closer to your patient in future. So that is extremely important, and a lot of customers and startups, they are, let's say, based in Austria. We do not have any sea, so we connect those customers of ours, which are startups, to their patient by being able to ship their goods seamlessly from A to any country abroad. Yeah, that's why we are a very international company, the most international company with 220 countries that we have our networks in. And with that, I would like to thank you, and I'm looking forward to some questions.
Thank you, David.
Thanks.
We're also looking forward to your questions, but you still need to wait for them because you will be on the panel later also,
Sure.
and we'll discuss the questions later. Thank you
Thank
very
you.
much. Next, I would like to ask Esther Groth on stage. She's digital manager, and her colleague Vera Böhmugrabi, she is brand manager at Novartis. Welcome here on stage. And you will present Ada, your healthcare companion, we call it.
Thank you, Irene. Welcome to the audience and welcome to the digital audience online. So a warm welcome from Esther from the digital team and myself from the marketing team. Question to the audience. Who of you suffers under back pain frequently? Just raise your hand. So some of you, and so there's Paul, maybe the brother of Mark, Ursula. So let's get to know Paul. He's in his beginning of his 40s, he's married, working in finance, sitting quite a lot, and suffers under back pain for about 4 years, under chronic back pain. But when he actually thinks back, his back pain started in his 20s. He takes painkillers, and that works so and so. And recently there were more symptoms coming. He's stiff in the morning, he's very exhausted, but he doesn't combine these symptoms with his back pain. And the street you see is the long journey of Paul within his disease journey. The different stakeholders he's cycling within the healthcare system. And at the end of the day, he got the diagnosis of a rheumatological disease called axial spondyloarthritis that harms the spine and tracks autoinflammation within different parts of the body. And in Austria, it takes about 10 years until patients get the diagnosis of axSpA. And we took the story of Paul as the opportunity to think about how can we support as a pharmaceutical company to shorten patient journeys and to be on side of the patients.
So, as you've heard before, it's not at all easy to identify and diagnose rheumatic diseases. This means patients simply disappear. They are just a number. And people like Paul, they end up with no diagnosis at all. So, however, we cannot accept the situation. We have to do something about that. But where to start? Novartis asked itself how they can improve the situation of Paul. And they found the solution in data. An AI model displayed as a symptom assessment embedded in websites and apps, and using a vast repository of clinical data. This sounds too good to be true, doesn't it? But it is in fact true. And this solution is called ADA and is provided by the vendor ADA Health. Before we will tell you what ADA Health is doing, we want to say a few words about ADA Health. ADA Health has partnered with Novartis since 2021. Its symptom assessment has been ranked as the #1 medical app in more than 140 countries. And ADA Health is currently available in 7 languages and growing, and it is also certified as a medical device. So, how does ADA's AI now work? At the beginning, the user enters basic health information, for example, demographics like age and gender, and then also information about his or her medical history. Then the solution detects the most troubling symptoms. It refines the information about these symptoms with more detailed questions. And then the probability model and the medical knowledge of ADA's AI derives at a statement for the most probable conditions. If there is a rheumatic disease involved, then we as Novartis will also provide next best actions, like for example our online doctor search for rheumatologists. Now we are very proud to also present you some figures how ADA actually impacted the patient pathway. So after using ADA Health now for almost a year, we can say that the symptom assessment is used 600 times per month. Up to date, we have diagnosed more than 3,000 patients with rheumatic diseases, and of those, up to 15% use our next best actions, like our doc search.
And now we invite you, the audience, to try ADA Health. Just scan the QR code or go on www.inforheuma.at and put in your symptoms, whatever it is. Thank you for your attention.
Thank you very much, Esther. Thank you, Vera. A real companion. Thank you very much. And also, one of you will join us on the panel, and the questions will come and answers will come later. Last but not least, in the staccato series of presentations, I would like to ask Lukas Meil on stage. He's managing director of SanusX, and he will present how you support employees' health with Mavi Work.
Thanks for the introduction, Irene. Today I would like to introduce you to one of our portfolio companies and offerings, Mavi. But before I introduce you to Mavi, I would like you to meet Paul another Paul that you have seen before, and also Lisa. Paul is a 24-year-old professional, and unfortunately during Corona he has lost his dad. Since that time it seems like he has also lost his drive, his motivation, his energy and his passion for life. Probably Paul is suffering under depression, but he doesn't even know yet and is therefore not seeking for help. Let me also introduce you to Lisa, a 34-year-old young manager and also a single mom. Unfortunately, Lisa doesn't remember when she had the last night of a good sleep. And recently she has also started to observe that certain situations make her really anxious, situations that didn't bother her in the past. And she has also experienced something that she thinks could have been a panic attack, but she doesn't have time to really look into this and therefore isn't seeking help neither. So Paul and Lisa are in their current phase of life facing some sort of mental health challenges. And they're not getting any help. And with this, they're not alone. Mental health issues are on the rise. If you look at some data, depressive disorders, for instance, increased by 28% since COVID. Anxiety disorders increased by 26%, both worldwide. At the same time, 44% of the global workforce were extremely stressed in 2021, the highest level ever. And probably as a consequence out of this, working days lost due to psychological illness increased by 41% from 2011 to 2021, in 1 decade only. And just as Paul and Lisa, very few people are seeking help. For instance, 1/3 only of people suffering under depressions are receiving any kind of formal mental health care. And the numbers for other mental health issues are even worse or at about the same. And in this environment, we have already started to make a difference with Mavi. Mavi is a corporate healthcare provider that helps companies and their employees on their journey of staying healthy and getting healthy, physically and mentally. And in the area of mental health, our core service is based on the concept of individual one-on-one coaching. And in this field, we actually built on 20 years of experience with our employed mental health experts, such as psychotherapists or psychologists, mediators, and other professions. And whilst we know that once a session has been taken, it's highly appreciated and can lead to a lot of improvement, we do know that 6 to 8% appreciate such holistic offerings, also in a work environment. We do see that only a small percentage of all the eligible employees of 150 corporate customers are taking advantage of such services, meaning are using it. And this is why we are assuming, or we're assuming, that there was a lack of awareness of the problem and that you can actually treat it, and that there is also a barrier to access such services still. And this is why we went actually digital with our new Mavi digital portal, which is for the time being exclusively available for the employees of our corporate clients. With this portal, we are providing instant support to mental health expertise and also mental health experiences 24/7. On the one hand, we help people like Paul and Lisa to understand that they have a problem and that it's normal to have a problem and that it's possible to get out of the problem with the right help through regular communication, education campaigns and events, which we are distributing across the communication channels of our corporate clients. Additionally, we facilitate access to lower entry barrier offerings in the digital world. Paul and Lisa can, for instance, do a self-test to evaluate how they are really doing. They can understand how they should be doing, and they get instant advice on which steps to take to feel better. And if it's required that they actually speak to mental health professionalist, then booking an appointment is always just one click away. On top of this, we can actually scale the expertise of our healthcare professionals much easier through content in all kinds of formats. Podcasts, live streaming events, video or text. And of course, the digital solution has also helped us to ease the burden of administrative tasks like the booking system. So it is our goal after launching the portal this year only to still provide it to 30,000 people this year and many more in the pipeline across the next year. And of course, we are moving into the range of 120,000 people by the beginning of next year, and many more customers and employees to come. We don't focus on mental health care only, as I mentioned at the beginning with Mavi, so we can provide a holistic portfolio across physical and mental health diagnostics, physical, mental health, and nutritional support programs, permanent ones, temporary ones, and we do all of this, of course, out of one hand. And if you would also like to support people like Paul and Lisa in your corporate environment, or if you would like to join us to create new offerings for the corporate health environment, then please get in touch with us.
Thank you, Lucas. Lucas, you can already take a seat over there, because now it's the time to start the panel. And I would like to ask our patient, so to speak, onto the panel. Our patient is called Martina, not Paul, not Lisa, Martina. Martina Hagspiel, she is front woman and editor of Kurvenkratzer. Why do I call her a patient? She was diagnosed with breast cancer in 2010, and that led her to invent a serious game to fight the ups and downs that you have as a patient, as a cancer patient. Martina, we want you to put the patient into the center. Please have a seat over there.
Thanks for having me.
And I would like to also call on stage again Gerhard Ladengruber. Thank you very much. Labib. Can you please sit over there? Thank you. Ursula again, and Esther. Have a seat, and I will take a seat over here. I hope you can still see us and hear us well. And I would like to start the conversation with Martina. Can you tell us a little bit about what you have done at Kurvenkratzer? What are the products that you offer? What do you do in your company, and what have you done personally?
Yeah, we do too much, basically. There are several. I'm wearing several kind of hats. On the one hand side, I'm a typical patient advocate, one of the few Austria offers, being a former patient and trying to bring my knowledge into, I don't know, ad boards, up to the mission cancer of the Bundesregierung here in Austria. Then I'm running a patient organization which is called Influencer. There whatever we do, we try to focus on patients' empowerment, and we try to talk patients' language. So in the patient organization, we try to bring a lot of information about patient advocacy on the one hand side, so people would understand what patient advocates basically do, because it doesn't have that information didn't come to Austria yet. Then we try to empower them in their job, and from the company side, which is the name is Kurvenkratzer, there we are basically a digital healthcare communication agency, and an online magazine about cancer. But we are really like colorful, cheeky. We do talk without fear about cancer, and we run it like similar to a lifestyle magazine. I mean, the lifestyle would be cancer then, but we try to be very, without fear and without a taboo. In the agency, we focus on, we're patient-driven. Not only me, I'm not the only patient in the company. I have another patient working for me, and we have direct relatives in the company. They bring their knowledge into the company. So we work with a group of freelancers. We do a lot of videos, podcasts, and patient journeys, like many different digital solutions. And it happened that we came across serious gaming. And so next week, the second serious game will
get launched.
Thanks for having me. So the first serious game we started is at the moment in the Med-Uni Graz on a clinical trial with 25 patients. There we it's called the Chemo Buddy, and there we try to accompany patients during therapy. It's not nowadays, you have to understand we are a tiny little company, so it takes us for ages. We have those innovative ideas, and then it takes us for ages to get it done. So at that time, we called it Chemo Buddy. Nowadays, we would call it the Cancer Buddy, because basically the therapy has changed a lot within the last 2 years. So their patients learn how to get prepared for the doctor's meeting. They learn how to handle their new situation of being a patient. They learn a lot about their life with cancer, and basically we reward them through the game. And the other game, which will be released or launched next week, is an escape room. And with the escape room, which is a game with riddles, and with the escape room we explain the topic of health data. So if you play the game, you should know what is health data, how would it be, so I don't know, it's the funniest English word ever.
Yeah. Pseudonymized.
Yeah, something like that.
You should know.
Yeah, and how you would bring it toward research, basically, yeah. Mm-hmm. So people have to pseudonymize their data in the game and everything. At the end, it's in 40 years on the moon, and you're part of a team, and you have to cure your team member with an eye disease. But yeah, with all of it, you learn about the great advantages of health data.
Yeah. Yeah. Amazing. Is really, really necessary, as in particular in Austria, where sharing health data, people have the perception of this is really very difficult, and they're scared, and there's lots of concerns. Yeah. And as far as I know, you also didn't develop it alone, but you developed it together with Roche.
Yes, it was actually Roche came towards us, and they had a basic idea of the whole thing. Like they knew they wanted to explain the topic of health data, and they knew they wanted to do an escape room. And there was a very ambitious team from Roche, and the four of them and a couple of us, we worked side by side the last year on it. And yeah, I'm actually happy that it will be released next week. The thing is done.
Yeah. Cool. Congratulations.
Yeah, thanks a lot.
Ursula, I would like to ask also the patient's access is there. Do you have numbers in terms? I mean, you did show really a lot of numbers, huge numbers, but is the patient really prepared to use all those digital tools? What's
not from the numbers?
Pick on that?
Yeah, not from the numbers. As I told you, like a quarter of not even a quarter of the Austrians do have this mobile phone signature, our digital ID. Mm-hmm. So, and this is necessary if you want to access your data, if you want to do digital services. Yes, this has to be increased.
Mm-hmm. Okay, and how do you have any ideas about how we could improve this?
Maybe, I think Jakub mentioned it. As soon as people see an advantage, they will use it. But we have to tell more stories about how you can use those services.
Yeah.
Last week, we launched a new service. I'm not sure whether you know. Do you know Vollmachtenregister? So since last Wednesday, you can empower someone like your husband or your wife to use in your name services of the Social Security. This is brand new, so a very easy way, for example, to go to the pharmacy and take drugs or pick up drugs for your husband. Mm-hmm. So who knows it? No one. Yeah. So, but you could use it.
Yeah, I have a question to you too. You presented the motivation, why the patient having it in the focus. What was really the motivation to start that very specific collaboration with DocDoc Health? Mm-hmm. How did you get there, so to speak?
I think we had a lot of motivations to do that, but maybe to sum up, I don't know, just a few of them. As I mentioned, we truly believe that digital health solutions will become more and more important, and that patients will benefit more and more from digital health solutions in combination with treatments, with innovative medicines. And so we do this project. Also, the same reason we are co-partner of the Health of Vienna is to learn a lot and to build up capabilities at AstraZeneca in Austria, because honestly, we want to be ready when digital health solutions are an important part of innovative treatments and medicines. Another reason is, of course, that healthcare system, governments, and the society wants to have more and more data even faster. And this was a way to collaborate with the Medical University of Vienna and to bring real-world evidence study for very important medication faster than it would be possible in normal ways. And, of course, adding to the building of capabilities and the preparedness, we really want to go this process further, deepen the collaboration, and also find new partners to start collaborations so that we learn more and that we also increase the benefit we bring to patients with innovative medicines.
Mm-hmm. Thank you. And also probably the diversity of potential partners is also an issue. And I would jump over to the other side. Labib, you're a kind of an unusual partner of Health Hub Vienna, something more exotic than a pharmaceutical company or a hospital or an insurance. What is your experience in working in this field? Now you've been a Health Hub Vienna partner for a year already. Do you have anything to share with us, being a kind of exotic partner, an unusual partner? Is there something that you would like to say about that?
Sure, my pleasure. Thanks, of course, first of all, for being a partner, and we enjoy it because we learn a lot. We hosted one workshop where we looked into the future setting of how the optimal logistic could look like for life science and healthcare. And we've learned a lot. We've seen also that there's a big demand actually in such healthcare providers, clinical research organizations, startups, what have you. All the companies in this life science and healthcare sector have a big demand actually for efficient, forward-looking and sustainable logistical solutions, because it brings these entities really closer to the patient. And that's also something that I've learned on that in that partnership with you, with the Health Hub Vienna, that patient centricity is really the key. And for that, seamless deliveries, yes, as a very exotic member of Health Hub Vienna, I have to proudly say it's nice to be part of the family, because we learn and we can share experiences. For us, especially in a global logistics company, express logistics company, we have extremely big exposure to all kinds of industries, and there's a lot to learn from the trends that we had the last 20 years that are happening now to healthcare. Yeah, IoT, more the globalization, basically to be closer to the patient. This all is something that we've seen in other sectors, and it's of course for us very important to be then there as a trusted partner also for those companies to export better.
Thank you, Labib. Esther, you presented your collaboration with Ada Health. What in that collaboration, in the launch of the project that you did together, what went well, and where did you face challenges, and how did you meet them?
Yeah, it's a very good question, because it's not easy to convince everyone in a big pharma company to launch a chatbot. But what went really well was the cooperation with the marketing, because they were really into doing Ada Health and having a good new feature on their website. So they supported us from the beginning, and we worked in a very agile and close collaboration. And I think that was one of the biggest pros. Then as soon as we had to go from legal and data privacy, I think that was a game changer, because if you say that the legal department agrees, then everyone nods and don't ask any questions. So that was, a good thing to do first. And I have also to say that Ada Health as a company is a great vendor. They had a good alignment with Novartis Global. So in every big corporate, everything has to go to the global departments as well. And if they are perfectly aligned, then for the local markets, that's everything. So that was also working smoothly. And I think from the learning sides, there is always room for improvement. So we launched it first silently. Then we started a couple months after with the promotion and realized, what we have to improve. And now we are doing that, but at a very, I would say acceptable pace. So we are not rushing into anything. We're just observing, collecting numbers and improving as we are going. So
thank you. Cool. Great learnings that you can share. Also jumping onto the other side, Lucas, SanusX really has the mission to develop any kind of healthcare service. Why focus on corporate health?
Thank you for the question. I think in the area of corporate health, there are two main answers. One is on a societal level, and the other one is on a corporate environment level. To answer the first one, I think as a society and looking at the healthcare system as we know it today, we have to admit that the healthcare system is going through transformation and challenges. And at the moment, the healthcare system is built on two pillars. One is the public sector and one is the private sector. Now we have gone through two different crises. The first one with the pandemic, and the second one now the inflation following the Ukraine crisis. And we have to admit that things are getting more expensive and fewer people and also institutions can probably afford the proper healthcare system. And that's why we believe that a third pillar, or even a fourth or a fifth, step by step, is needed to support the healthcare system. And as the third pillar, we count on companies and corporates. Which leads me to the second answer. Corporates shouldn't do this in order to tick the box within a CSR program, but they should do it also to benefit as an organization, including the employees of it. Why is that? I think the most obvious and prominent reason is that if your employees are healthy, more happy, they can also be more active overall in life and will therefore also deliver a better company or corporate outcome at the end of the day. At the same time, of course, it also provides corporate advantages in the context of employer branding, the war for talent, even retention, decrease of sick days. We saw before that there is a high number. So these two things would be my main answers. And then there's just one sentence on the third reason. I think the public sector is still struggling to mobilize people to invest personally, individually into health prevention. It's behavioral changes that we need to drive. And I think companies can take an important role in order to decrease this entry barrier. Because if you have a lot of offerings at work, starts with the Mensa, with the nutritional offerings, nudges there, and a lot of offers that can be used easily and quickly without losing time and thinking about it too much, they can actually mobilize a mass of people to also invest into health prevention, which will also support the healthcare system.
So to really build a strong, important pillar to base the healthcare on is us, so to speak, as not yet patients, and maybe patients.
Yes.
If you have any questions from the audience, please raise your hand, speak up, the mic will get to you. You know, I have prepared quite some more questions, but the idea is also to include you and answer your questions. Are there any questions? Yeah, please.
Hi, this is Emil Zeno from Optimus Consulting. I have a question for Ursula, I think from SVC, right? For the lady from the Austrian e-card company?
Ursula?
Ursula, yeah, sorry. It's a really great wealth of data that you have there. And I was thinking, do you plan on any collaborations with medical researchers that can use, for example, this data for the estimate of efficiency of drugs, especially new drugs that are being introduced in long-term studies?
Okay. We are speaking about two kinds of data. Data we collect for the social security, for sure not. But there is data collected within the electronic health record, and there might be a possibility, but some years ago, the former Minister of Health did not allow this, but it might change.
Aren't there European-wide initiatives that...
Yes, of course. European health data space,
exactly.
Yes, they're speaking about this.
How is your involvement in there?
I mean, the... in the beginning phase at the moment, so we have two approaches. On the one hand, we have to be technically fit, and on the other hand, of course, we support the legal aspects at the moment.
Yeah.
But it will take some more time.
So the legal aspects are the real deal breakers still at the moment, or is it just let's call it
not
challenges?
finished yet? They are not finished yet. So. There's still work to be done.
Yeah. Thank you. Yeah. Any other? Please.
Hello. My name is Przemek Grzywa from Revolve Healthcare from Poland. I have a question to Labib. You mentioned that you have investigated into the logistics within life science and maybe some gaps or maybe some future offering. Can you maybe elaborate a little bit on that? What can we expect, or what were the missing gaps that you have investigated specifically within the life science and then logistics area?
Sure. I cannot share, of course, all the details. However, I can tell you or summarize to you the biggest trends that you will see. So, yeah, my slide said this direct-to-patient delivery will be a very big pillar in that. That the patient is the key, and a lot will go around him. Yeah, everything is set to be around him. So that will be one big stage. We've also seen more and more interest to bring biological specimens actually from A to B. A lot is happening here in Austria also when it comes to clinical research and new methods of treatments.
Can you give us some examples what a biological specimen is in that?
Yes, it could be, of course, let's say a normal nasal swab or a blood test kit as an example. Those would be examples for such biological specimens. Yeah. It is not only then driven to us as human beings, but of course we can go into animal specimens and so on, because it's also, there's a big demand for that. Those are definitely very big pillars. We had also actually one of the items that is needed is we all learned through the COVID pandemic that supply chain resilience is extremely important, and it was unfortunately again through the Ukraine crisis there was a big gap in resilience again when it comes to supply chain, and emergency response was also one of the topics that was discussed there. Be it that tomorrow another pandemic starts, how do we want to cope with it? These are very big lessons, and the pressure also on logistics, of course, to cope with these sudden emergencies. Of course, nobody plans it. These would be three big topics, I guess, that were demanded, and there are a couple of other things that we can bilaterally probably speak about.
Thank you.
Thank you.
Katja?
Thank you. I have another question for Labib, please. Do you think about new ways of transportation as well, like using drones? This is a huge need for hospital and care facilities and transporting human probes like blood and everything from the hospital very, very fast to the labs. Is this on your roadmap?
Yeah, so of course so we just initiated actually in summer this year as an example full loop service, which means in principle that there are two legs. Let's say you are a clinical research organization and you have a hospital that conducts that clinical study for you. and you are the laboratory in this case. So in the first leg we send to you so that you can focus on your clinical research. You do not need to order dry ice whatsoever. You get a pre-packed dry ice package, and you just have to put your specimens in it. We already know upfront communication happened. We know already, okay, you need it picked up tomorrow and shipped the next day. It has to arrive, or the same day even, to a surgery, if it's a very, very essential piece of item that we're talking about. Yes, we look into, so that full loop service was just rolled out this summer. That clinical research organizations really can focus on their job. Also, it allows them to have more detailed monitoring, so there are daily reports included, so whatsoever to give also the clinical research organization as our customer 100% trust in the services that we provide, because you want to look into what's happening. Drones is a topic I cannot answer out of my expertise, to be honest, because yes, as mentioned also, we have 3 innovation centers globally, and that one would be a question I will highlight actually to our innovation center in Singapore, I believe it is, who are working with drones. But yes, we look into a lot of new methods. Direct to patient, as an example, is a very big one. The full loop service is one that we learned through the Corona pandemic, that there must be leaner ways to support clinical research organizations. We see it with a lot of startups that have tendencies for hiccups, actually. They innovate in a wonderful way, but then they forgot about the logistics. And suddenly we're talking about dangerous goods. And dangerous goods is not a small thing. We do not give the requirement. It's IATA, so the flight authority, United Nations body, gives those rules, and they say clearly that this is a dangerous good. Biological specimens, blood, any medical equipment that has batteries included. These things are challenging to be transported, but the patient needs it.
Infectious material also that we've seen a lot recently. Johannes.
Johannes Strome, I have another question for Ursula. In Austria, we have, we always talk about the digitalization, but then the administration really slows everything down for years. And with a very easy thing, just a couple of weeks ago in Austria, we have introduced the driver's license, which is the second most important document you use in the country, next to the social security card. We've introduced the driver's license on cell phone. You just can put it on cell phone. Bundesrechenamt has done it. So the question is, when do you plan to introduce social security card on handy?
Yes, we are working on this, but we want to have a solution that will also work in Europe. So we are thinking about this wallet solution, and we are working on this. The first step for this is for sure that we now introduce a new card reader. So maybe you will find one in the pharmacy. It's a new card reader, and this card reader will allow near-field communication, and this we might use for the new wallet solution.
One more extension. This will again take years. If
No?
you want to start, social security
Oh,
tomorrow with
yeah. No, it will not take years. No, for sure. We are working with this already.
You promise. We'll catch you on that. Yeah.
Yeah, Boton Ponner from AstraZeneca. And first of all, thanks to all the panelists and the presenters. It's been really a fantastic evening. And my question is, I tried to connect the dots now. So we've seen a lot of solutions for problems, and we've seen also the great, let's say, the digital patient journey that Elga and all the applications show. But I also heard in one of the maybe 2 presentations, and we know it by ourselves, a big challenge is the late diagnosis of patients and the long journey they need from to find the right diagnosis, the right healthcare professional. So my question, and I'm afraid it's again for Ursula, but maybe anyone else, how could we reduce this time to diagnosis and the right treatment at the right place? maybe with the already existing tools, maybe connecting them or integrating other solutions to really help and reduce the burden for the patients and actually for the healthcare system and the payers.
Well, join in.
Yeah, maybe Lucas, yeah, and also Martina.
I think that's the point I tried to make before. We need to make preventative health checks, for instance, part of a regular routine of people in their lives. And currently, I think the number of people who are utilizing the free preventative check is still very low. And people, even if they have mild symptoms, they wait very long until they go to a doctor. Even if they are diagnosed already with a depression, until they get a health appointment, or actually an appointment with a psychologist, a lot of time is passing, and the problems are just accumulating. They are very often not going away. And now I'm almost advertising what we are doing, but including it into daily or regular routines means to be where the people are, to be relevant, to build trust, and to make it as easy as possible to actually utilize these systems that are there already. And we believe that corporates can play an important role in this journey, because you are there almost every day, or at least 5 days a week, for a long period of your life. And if it becomes a habit of being at work and also utilizing health and wellness offerings, I think we can contribute a lot to exactly this problem.
Martina, yeah, sure.
I think we have to start far earlier, because health literacy is in Austria in a similar situation than the knowledge about health data. So we really need to start in kindergarten teaching people about their bodies and about how would I realize there is a symptom, not to a normal situation. So if we're not starting to teach people how they, what health literacy is and all the knowledge you need to know about around health literacy, I mean, we end up paying a lot of money for not doing it, and that will continue. We can invent that many solutions we want to, but if people are not, if that grassroots movement doesn't happen, it will cost a lot of money for ages.
Yeah, I agree. There was a recent study which compared health literacy amongst European countries, and Austria was second last.
Yeah, no wonder.
Yeah. Yeah. Maybe also, Esther, you want to add something, because Ada Health is exactly doing this, isn't it?
Yes.
What's your experience on this?
Yes, that's true. I mean, my colleague Vera, she said it in the beginning of the presentation that we are sometimes talking about 10 years of time where a rheuma patient is undiagnosed, which is, fatal sometimes and very dangerous. But I think what my two other colleagues here on the panel said is very true, that we have to start very early, and that we have to be there where the patient is or where the people are, because we sometimes make the mistake that we think we have a digital solution and we are only advertising it digitally. But the most important thing we found out in our promotion activities is that we have to advertise something like that in one of the biggest newspapers like Krone, because there people read about such solutions. And for example, the grandma is talking then about something cool from Novartis to their grandkids or their children who might have back pain, and then they try it out. And that's how it always works. And I think that is something we should use way more. I don't want to say, please put your money into Krone, because I think they are quite well off already. But that was just something we saw as a big thing to work on.
Yeah. Anniko, and then please, the mic over there.
So a question to Martina, actually, because you are here as a patient and as also representing your organization. You are sitting in the center, so let's say this is a patient-centered panel.
Let's do so.
On purpose.
Exactly, and this is where my question is actually directed to, and also maybe partially philosophical and rather also for the future. If we act and think patient-centric, I also heard from a lot of other angles that it's from patient-centric is also turning into patient-empowered view. What do you think, what's the future of patients in the healthcare system, and how far can we work together and patient support? And
I thank you so much for that question.
You are welcome. I'm really, really interested in what you have to say about this.
We're actually working on it. At the moment, we are in Austria, we're in a situation like the women's rights movement in the 60s. I mean, I'm not here to burn my bra. It's actually a funny thing to say, being a former breast cancer patient. We are working on it. We try to, we are writing, like I'm in part of an organization called the Alliance of the Oncological Patient Organizations. There we work on a curriculum at the moment where you can go out to the university and study patient advocacy for 1.5 years. And you would come out of it as an academic expert on patient advocacy. Why do we do that? Because we need entry to research, clinical trials. On a very, very early stage, we need to be able to be part of the study design. Otherwise, patient-reported outcomes will not be as we wish them to be. We need to be in certain ad boards. We need to be able to vote. I mean, we're the biggest group, like money-wise. We need to be able to put our interests first, and we need advocates for that. So we are working, we really try to make the situation for patients in Austria better. I mean, everybody is talking about patient centricity and patient involvement. Everybody loves the term, but to be honest, having the patient in the center, it's in the way of everybody. So we need people who are educated and who are able to take their role on a professional basis, maybe as a job. That's actually what we really are heading towards. We really want to make a job profile out of it. So basically professional patients. Yes. Yeah, that would be the goal. I mean, this is a long way to go. But nevertheless, I mean, they're doing quite a lot. I'm working cross-border quite a lot. And they're far away ahead of us in Germany. I mean, the German-speaking countries are far away, far behind of many other countries in Europe when it comes to patient advocacy. But Germany is a little bit ahead of us, and they are already They did already build very powerful working groups where, like the really important stakeholders. You know, the thing is, we as a patient, we cannot. It's similar to the women's right movement. Women were standing there in the 60s and they said, well, we need more rights, and everybody said, yeah, whatever. And it's similar now as we patients, we say, well, we need more rights, but we need other stakeholders to stand up for us and say, yeah, well, they obviously need more rights because they have to come to the table, they need a vote, they need to be able to vote. Yeah. So, thank you.
I would like to pass that question also on to Gerhard, because patient-reported outcome is exactly what you're doing in that project, together with Dr. Kelf and the Medical University. What is your experience in this? Do the patients feel served better, empowered better? Is this something that you can tell already?
It's a very good question, and honestly, as we have started this week, we don't have any clear insights about it. But what we have learned is that so far, also during the process, during setting up the project, is that how can you convince patients to use an app? And how can you convince doctors, for example, physicians to use this app? I mean, this is sounds like an easy question, but it's the most critical one.
Sure.
And in our case, of course, you can pay doctors to use it. Yes, it's often done in the public health sector. It's the only way how doctors sometimes.
It's not what AstraZeneca would be able to do.
Of course, yeah, of course, yes. But nevertheless, there should also be an intrinsic motivation. And in our project, for example, it is clearly that it supports the work of the treating physician. He clearly sees the benefit. Not having to fill out all the patient forms. He can send the questionnaires via app to the patients, and they can also send information to one, to many, or to all patients at one time. That's a clear benefit why they use it. And the patients use it. And in my opinion, in my years of experience in the healthcare sector, patients use an app as soon as the doctor they trust recommend to use it. So the reason why the patients will use this app is because the doctors want to use it and the doctor recommend and ask to use it. And it's fully integrated in the process. And also to give, I mean, our project is not at all perfect. We will learn a lot, but what we already have learned in discussions about setting up it, that for example, it would also work from a technical perspective that patients send information to physicians. We have not implemented it because that would be far too much of a workload for the treating physician if all the patients immediately at any time can send information. But yes, it would be an even cooler feature, yeah.
Martina wants to answer.
A little story. During chemotherapy, I tried to put some successful moments. I told you before. I tried to put some, and I actually decided then I should share. I tried to put some successful moments into my daily routine, which was not very successful at that time. So I put many post-its actually on a door, and at the end of the day, I was able to rip off one of those post-its, and that was my successful moment of the day. But it helped me get through chemotherapy, and actually it helped me staying emotionally, in a good spot. So what we did is we put, because we were talking about motivation and how to fill in, I do totally agree if a doctor recommends something, people would really accept it a lot more. We put some gamification underneath, because I think as soon as it starts to be patient-driven and as soon as patients start to understand why they do it, whatever motivation it is, they start to learn from the knowledge they get from the app, and you can just put so much knowledge into an app, and it's amazing. And as long as they stick to it, and the thing is, you want them to stick to the thing. And that's why we used gamification for it.
Yeah. Bagel, another question. Here? Oh, sorry. Go ahead, yeah, and then we'll move on.
Jakub Fischl from Premica Med. I have an open question to the whole panel. What's the single biggest problem that you face in your projects? And probably the second part of the question, since Christmas is coming up, what would be the one wish that you have that could change?
All right. Do you want to start?
What's the biggest challenge? There are many. Healthcare is a complex topic, but I think it's really awareness across a broad mass for individual healthcare and really taking care of it and doing something about it, not when it's too late, but early enough. That's the biggest challenge that we need to overcome. And I think a lot of global brands, they manage to be relevant in people's lives without a real purpose. And we in healthcare, we still need to get there. And it's advertising, maybe it's being where people are. It's, of course, literacy, health literacy, and many, many other solutions where we need to get better to be present in people's lives. And what's my wish for Christmas? Privately or professionally? Jakub?
Professionally.
Still a lot of learnings until the end of the year in all the projects that we're active in, and we're not only in corporate health, we're also working with pharmacies, we're working with quick blood tests, we're working on active aging that we can turn into greater and better and easy impact by the beginning of next year.
A package of learnings. Cool.
I would say in that it would be two things that are challenging. First is patient experience. I think that must be very accurately met, because yes, we've seen a lot of projects already where a lot of data is gathered, so the patient wants it to be analyzed quickly to know exactly what he needs to do. Then yes, we need doctors to be out there to actually use technology. I believe that also brings them closer to the patient. Also, if we had a pandemic next time, then I was, as an example, personally told once to move out because I do not have a test result. So even though I needed something which was not related to coughing or anything related to COVID, I was not allowed to see the doctor. So yes, it's very bothering, and yeah, patient experience I think was very bad in this case for me. And the other one would be cost, for sure. Yeah, because in the end we're a express delivery company. We know that cost is a pressuring point, especially today. If we look into oil prices and kerosene prices whatsoever, everybody else is getting under pressure also from his own pockets, privately or professionally. So yes, those two things. And do I have to answer also the dream question?
The wish.
The wish. If Santa Claus were here.
Yeah. We can pass it on.
I would like
back to you later.
I think my wish 100% is to be 100% digital, because it makes life so easier. But that's my personal wish, that I can do healthcare things all digitally.
Okay.
Okay. The biggest challenge, for sure, it's not a technical issue. So what we do is, when we replace paper-driven processes by digital services, it's change management. And those paper-driven processes have been very helpful for decades. And so we have to change behavior. That's the biggest issue. And what I wish for Christmas is that we are proud in Austria about what we have achieved so far. Compare us to, for example, Germany. Very recently, they tried to introduce e-prescription. And they have similar ways how to hand in a prescription at the pharmacist. But like the versions we have to go with a code, it's not allowed there. It was actually a shitstorm when they tried to do it. So we are far ahead. So we should be proud of this.
Yeah. Thank you. That's a good wish. Martina.
If I would have a magic wand, I'd always wish for the same, being and staying healthy. On a Kurvenkratzer influencer level, I actually would love to. I mean, we do have so many ideas, so it's always the finance part we have, which is stopping us at the end. So there's a big wish, and when we come to a systemic level, I really would love to have the systemic change, that patient involvement and the job profile would be really an option, like a possible solution, so that patient-reported outcomes in the future are like systemically done. Yeah. That would be great.
Yeah, cool. True.
Yeah, I think that my biggest challenge is exactly what Ursula said. Hers is not, because I struggle with isolated systems which are not connected. And every time a company is approaching us with a cool new software solution, the problematic thing is to build connections. So every company who wants to work with Novartis, they should have an open API, and they should be able to work also on a technical project with us. And my wish would be to have many more occasions like this one, because I think it's really nice to exchange and have this talk, and also to have this in person.
That's a wish. I can be the Christmas lady for it next year then. Go ahead.
I think we have already heard a lot of challenges, so a lot of different challenges, but maybe very brief. One obvious challenge is, if you have a perfect project, if you have the perfect partner, it's perfectly financed, then you still have the challenge that you need to have all the internal resources to completely and fully meet all legal requirements and also data protection requirements. That's a lot of work to do and has to be done by everyone. And what I would wish is I have wished in my whole experience, in my whole working life in the healthcare sector, some kind of a try and error mentality, and also a try and error paragraph where you can try something, where the public sector can try something, but also public-private partnerships can be tried without fully meeting all the highest standards.
Thank you very much. Next question. I hope that was all the answers that you wished for. Perfect.
No, thank you for this, Irene. And the question is for you. What will happen in the next 2 years? Maybe you can add your Christmas wish as well. No?
Yes. Okay. So the biggest challenge for Health Hub Vienna was manifold also, but it was definitely bringing the diverse organizations who are stakeholders in the healthcare system together. Yeah? That's the biggest challenge. I mean, we are really, really proud, for instance, to have Labib and DHL on board, which is already a step outside, so to speak. Yeah, we called it rather exotic partner, but still it's a very, very important issue in healthcare to manage logistics in a very professional and knowledgeable way. Yeah, so that was really the biggest challenge. The biggest wish is to make it complete. Yeah, to really have every stakeholder in healthcare on board, including, most importantly, also the patient representations. That's the biggest wish. And what is to come in the next 2 years is exactly this. Yeah, I'm happy to be able to say that we will have the first social insurance as a partner at Health Hub Vienna in 2023. It will be AUVA, so the General Unfallversicherung, will team up with Health Hub Vienna for 2 years. In fact, we will have Roche Diagnostics on board, stepping out into the medical device fields. So that's already fixed for 2023, and the plan for the next 2 years is really to expand this and build on this, and also bring the people, the diverse knowledge together and share experience in order to speed up. Thank you for the question. Any other questions? Daria.
Hello, I'm Daria Pavelio from DHL Express Austria, and I would like to have an open question. I'm just for several months with DHL Express and in lifestyle healthcare as well. I'm just coming from medical devices area, but I already realized that direct-to-patient topic is very important. And I know that in Switzerland or in Germany, the possibility to get your drugs at home, like normal Amazon package, is absolutely normal. Yeah. And when this situation will come in Austria, what are your thoughts? Or because I think it's great for every patient, for every person to have such an easy way of getting. Thank you.
Who wants to start?
I have ideas.
So the question was if we think that we should open up delivery for medication, right?
Yes.
In Austria.
What do you think, or how can we achieve this goal? How quick can we achieve this goal? Mm-hmm. Because I think it's very important to be.
Yeah, I think it's a legal question.
Yes, it is.
When it comes to OTCs, obviously it can be delivered already. When it comes to prescriptive medicine, there's regulations in place. In the case of prescriptive medicines, the sources are still pharmacies. We have good distribution of pharmacies, 1,400, I think, across Austria. They have about 400,000 customer contacts a day, and we have seen in studies that they are the most trusted source when it comes to healthcare. So if you get something prescribed by your doctor and the pharmacist is changing it, you trust the pharmacist sometimes more than your doctor, right? And I think they have a strong position to defend prescriptive medicine to not be delivered. But I think they need to open up to be more flexible when it comes to the availability of prescriptive medicine. And we're actually working on a project together with them where you can order your prescriptive medicine via an app and can pick it up also through a vending machine 24/7. This is a next step. It's not delivery yet, but at least you don't have to go there twice in order to get there, learn that your medication is not available, then come back later, or to learn that the pharmacy is already closed because they have still very conservative opening hours. So it is a step where we are partnering with pharmacies, how we can create more convenience for customers. On the question when it will open up completely, I cannot give you an answer. I think this is Austria, and I think there are many stakeholders who are also interested to not open it up totally, maybe also for very good reasons. But that would be my quick answer. Not completely satisfying, maybe, but...
Because I know in Switzerland it's already for 20 years, Swiss, and it's nice to have here.
Ursula, the solution that you presented before, isn't this a kind of a workaround,
it is,
technological workaround within the legal framework, without even erasing the need for the legal framework to change?
But there's nothing to add to what Lucas said. Yeah. But at least we have some possibilities to make it more easy to pick up trucks.
Thank you very much. Yeah.
An open question as well. I'm always wondering, we have really great innovation and digital tools, but that's often for me just the starting point. When they are not used, they're useless. So what are your ideas to inspire people using digital solutions? And Ursula said there's really few digital IDs, and would it be think of tutorials, face-to-face tutorials, to really teach the people how to, am I getting this ID? Because I love your systems, I really use them, and I really think, as you said, you're much more wider than Germany. So you can really be proud of your solutions. I really appreciate them. So that's the point for me, how to motivate people to use these great solutions.
I can start. I learned last week that there are some programs so that students or young people in school, they can activate this mobile phone signature. I was told that there are 350 or 400 people visiting schools so that young people can, with their, additionally to their edu card, the school card, can activate. This is a very good step to start very early.
Cool. So that can happen today, as of today already.
It happened in the...
So basically, it's us as parents also to bring this into the schools and tell it to our kids.
Yes.
Yeah.
But also to add, it's also important to motivate the elderly people. Because do you have any demographics, how old the people are who have the digital ID? You don't.
No.
Okay.
I think here's also something that I see already from another industry, because if you look back into retail about 20 years back or last 10 years back, it's exactly the young people that drive this change. Why this technology-driven change and transformation is happening right now is because of Generation Z and the young generation per se. These kids, juvenile students, they wanted digital because if you ask me also, I do not see the point sometimes to go to a doctor just to pick up a prescription. So that solution is impressive, of course, and saves me time. Because, I mean, if I look ahead also like in time, I will be one of those silver surfers, you know, in like 15, 20 years. So I will be also part of the silver economy. And the silver economy boom is exactly what we saw the last 10 years with users of e-commerce businesses. And that same is coming now to the healthcare. And patients do just need to know that they have the capability to be able to use digital solutions. I mean, I look, fantastic movements are like in Emirates or Qatar. These countries are 100% digitalized. And that gives them the possibility actually to be so lean and give every service, even in healthcare, digitally. And that may actually saves also costs, of course, on the long term. And that will be, of course, the question, who's going to pay for these things? Yeah. So that's why cost, again, is one of those problems.
Okay. But I have to add one point to this. Of course, for us patients, it is perfect. We just call the doctor and ask for whatever we need. But have you ever thought about the situation for the doctors? Mm-hmm. Completely different now, because they were used to having the patients coming in, telling their problems and so on. And now they have patients coming and calling all the time. So have you ever been in the waiting room of a doctor? It's terribly loud because the people assisting there, they have a lot to do all the time. So this means change again. Doctors have a totally new situation.
Yeah.
I would love to add something. It's always the same what I have to say, include the patient, but I really think there are many patient organizations out there who are running their organizations on an expert level, really. And they are very authentic on the one hand side, and they have a high credibility. So those are, and they know their people, they know their challenges. So if we are talking elderly people, silver surfers or whatever, they would know how to explain because they're facing the same troubles. So I really would go towards patient organizations and include them to explain things because they use the same language. It's peer-to-peer.
Anything to add?
Yeah, in my opinion, we should also be careful not to overestimate digital. I think digital is not per se, just because it's digital, a perfect solution. It's like, sometimes it's like a pen and a pencil. You only use it if it's really helpful for you. So I think if we want that it's been used, the digital solution, it has to really fulfill, for example, an unmet medical need, or as in our case, an unmet research need, and it has to come at the right time. It has to be the right team, the right collaboration, and in the end, it will only be used if the people using it see and feel a clear benefit. So if it's a patient tool, then the patient have to feel and see a clear benefit. If there is an HCP, a healthcare professional involved, it has to be a benefit for the healthcare professional to use it, additionally to maybe a financial benefit. Yeah. And yes, gamification and all those tools, and also information that you can provide, add-on information, I think that it's helpful, but in the end, they will only use it if it delivers a clear benefit.
I know.
Yeah.
That's been one of the problems at the DIGA introduction, obviously, because the DIGA, you get a DIGA only. One of the rules that the solutions have to comply with is there must not be a benefit for the doctors, for the healthcare providers. That's a financial point of perspective, and I do agree that it still needs to be a benefit that can be felt, but it must not be a financial benefit. One question to you, Lucas, because you're also working on mental health. Mental health is a very sensitive issue. Do you see digital solutions really replacing the traditional physical analogous solution in mental health? Is this something that will be 100% digital in the future?
I guess there are lots of hypotheses around this. I would say to a certain extent, yes, but not completely. Yes, in the sense of diagnosis, eventually self-tests, self-aided programs and support. Also, once you have been diagnosed and you get recommendations and advice on what to do, you could have digital therapies and digital coaches who are cheering you up in order to stay on the journey and do something for your mental health. So I think big areas can be digitized completely. But what I believe, at least for the time being, is that it will still need and require the human expertise behind it. You need to know that there are people behind it who are still approving your diagnosis, who are still creating this therapy for you in order to trust it. This is at least for the time being. And on the other hand, mental health is also a lot about empathy and kindness. It's also about the need to being heard. And if it's just machines, if it's just AI, I think the needs of a lot of patients would not be met completely. And therefore, I believe it's yes, definitely contributing a lot to more mental health care, also maybe more precise and easier to access mental health care. But it will always keep a human aspect as well.
Ego, you want to add something? Sure.
Yes, I thank you, Lucas, for that. But I also see the other side of the story, like mental health being negatively affected by the use of devices, and getting people back to devices to recover their mental health is also a questionable matter. How you say that?
Okay, thank you. Also dependency, maybe, addiction.
Yes, exactly.
Can be something that we need to consider.
I think digital can certainly bring a lot of efficiencies in the healthcare space, and especially in the mental healthcare space, meaning that the practices can become far more efficient, no time wasted by professionals in appointment booking, changing, reminders, especially no-shows in mental health, which is higher than other specialties. It has a great role to play in reducing access barriers, but that should probably be in favor of the benefit for the healthcare provider being fully there for the patient in person as a more added value than actually replacing, as the provocative question of Irene was loaded with.
Thank you very much. If there is no more question, I have one last question and challenge the panel again. What, in the last 2 years, or maybe more, was the most inspiring digital health solution that you came across in the work you did, that really motivated you to move on?
I don't know it by name, to be very honest.
It doesn't matter. Describe it, please.
Yeah, personally, I come from a doctor's family, and I've always seen these discussions when these guys, the doctors, the surgeons, sit at the dinner table and they talk about their surgeries. And I didn't believe actually in something that was talked about, the precision medicine. Yeah, that it's more personalized medicine. I did not believe it. I was ignorant, to be quite honest, because with methods we can actually personalize medicine to someone's, now I'm not the professional in this, but someone's genetic code or health status, his sickness or any other external, anything that impacts him. So I believe personalized medicine is actually a big thing. I mean, there are so many different allergies that we cannot put to everybody here in the room. As an example, somebody who has this super fine allergy that has its cure, and it's possible.
Yeah. Anyone? Yeah.
I will continue with e-vaccination because it was really a speedy rollout in Austria, and we can say never waste a good crisis.
That's a good one. Let's hope for not another crisis to come.
Yeah, but it's still from the point of e-vaccination, it was a booster.
Yeah, cool. Thank you.
I can continue. I mean, there is so much out there, and people do amazing stuff. I want to point out an Austrian startup because actually he's a friend of mine, and we shared office for a couple of months. It's Happy Med, and for sure many of you know Philipp Albrecht and his idea. His vision was to we do have a virtual reality, and if somebody has to go into surgery, we do it without anything. We keep them awake, show them a nice movie, and they're good with it. And he managed to do so, which is amazing. And I thought that's a really, like, it's amazing that it really works. And he's very successful with it in the meantime.
True.
And I have to point out, with that crazy idea, and that's what amazes me that much. The idea sounds crazy, and he found people who believed in him. And you really, at the end of the time, you need somebody who really believes you into your idea, and that's why it's really cool.
Thank you very much. I'm honored to say, and also proud to say that INiTS was one of the, as an incubator, was one of them.
Yeah, but it's so cool.
The early believers, so to speak.
It's so cool. Yeah.
Thank you very much for mentioning
You're very
that.
welcome.
Yeah, I also have some doctors in my family and among my friends, and for them it's not always about software, but rather about hardware. And some friend of mine, he told me that now they have the possibility to use mobile ultrasound devices for only few costs. And that was a game changer for them because they were starting doctors, and investments are at that stage, of course, a big deal for them. And so they said that they can now subscribe a mobile ultrasound device and do it with their smartphones. That's
amazing.
Great for them.
Cool, thank you. Gerhard.
Yeah, I have to say, thanks to our digital engagement at the Health of Vienna, we have met so many different startups in the last 3 years. Two I really remember because the ideas were quite impressive. I'm not sure about the one. It was some kind of oncology efficacy testing in fruit flies. In the very early stages, it was impressive. Another one was impressive that just by listening to your voice, they could do some diagnosis for COPD. That was also very impressive. But the most motivational one is clearly maybe not the highest sophisticated, but the one we finally have made to implement in Austria. So clearly our project with DocDoc Health. And I will also add the e-vaccination register. I have experience in the payer sector as well, and this was really impressive to see it also from a pharmaceutical perspective. It was quite impressive, yeah.
Thank you very much. Big head to you. Lucas, last but not least.
Yeah, one that I came across privately already, I think a few more years than 2 years ago, is Be My Eyes. I love it for its simplicity and the great impact it has. It actually connects seeing impaired people through their cell phone with a mass of volunteers who can be their eyes through the camera of their cell phones. I myself volunteered. The use case I volunteered in, for instance, was a seeing impaired grandfather who wanted to buy a gift for his grandchildren, and he wanted to choose the right color. So he could touch and feel what the gift was all about. He had bought a couple of different ones for different grandchildren, and he wanted to get the red one for the one and the blue one for the other one. So it's super simple and super impactful. I think a newer one is Noom, which is a food tracking app that also works with exercising in order to help people get their nutrition under control, but also their weight. And what impressed me there is that it's driving behavioral change, and they have done a study, 36,000 people, I think, and more than 70% of these 36,000 people could actually reduce their weight as they wanted to within 9 months. And this is driving behavioral change, which we should all aim for with our solutions.
Yeah. Thank you very much. I would like to quickly wrap up. I believe that I hope we were able to show quite some examples of great things happening as of today. Digital health is there already. We've heard quite a number of inspiring stories, also personal experience based. I would also like to thank you all for being with us and point out again to the digital audience that there are the digital booths. You can get even more inspiration. You will see solution DocDoc that has a digital booth. Also Kurvenkratzer has a digital booth that we heard about. But there will also be Datlowe will also be, you can see and get in touch directly with the founders and the team. But also Doctify, MedBee, MyReha, Naboto, who is really the technology behind Visite that you explained, Ursula, Quick Ticket, and Teledoc. Thank you also to you for presenting your solutions, and I wish you all a nice time still, digitally exchanging experience, chatting with each other, getting connected with each other, but also hear us take the opportunity to have some drinks, some good food, and some great conversations, and release you into a still inspiring evening. Enjoy it. Thank you for coming. Thank you all for being with us and for the great presentations.